Okay, so I'm gonna give 2 injections. I'm first gonna give you vitamin B12. She's gonna get 1,000 micrograms or 0.1 milligrams, 1 milligram. So I'm first going to clear this with a blunt needle. So I'm gonna go to what she needs. 1, inject and clear. Okay, and then when I take this needle out, I'm gonna swoop it in here and then release it. Nothing ever hits the floor, I'm not touching the needle. I'm gonna attach the needle I'm giving to her and I'm gonna clear this one as well. So she's getting again 1. So I'm clearing this. Now I'm gonna lift it back up to 1, okay, and I'm going to now administer and inject. So I'm taking this to 1, making sure there's no bubbles, making sure I'm eye level. So the vitamin B12 is an intramuscular injection. Would you like it in your glute or in your deltoid?
My deltoid.
Okay, so again, I would be over here. I'm feeling for her landmarks. Okay, so I'm going down here. I'm going 3, kind of making a zigzag down. For her I'm going to put it in. I'm gonna kind of widen and then I'm gonna put it in like a dart. So I'm gonna inject it straight in, and I've wiped this with a alcohol swab and inject it back completely. So the needle goes straight in. Again, I'm wiping everything. I'm disposing of both the needles. I wiped them with the alcohol swab before and after, wiped her arm. If she's bleeding, I would give her a Band-Aid. So this was her vitamin B12. Now for her heparin, she's getting 1,500 units. So for her heparin here, it's going to be a sub-Q. So again, would you like it in your stomach?
Mm-hmm.
And then left or right side?
Right.
Okay, so for her right side, so on her stomach, I'm going to go about 2 inches over from her belly button. So again, I'm going to clear this first for what she needs, so 1,500 units. Injecting air in. I've alcohol swabbed her stomach, injecting air in, and then I'm going to go 1,500. Again, alcohol swabbing. Now here I'm pinching an inch of her, since it's sub-Q, it's the fatty part of the skin. So I'm pinching in, and again, I'm still injecting it like a dart. It's going straight in and coming out nice and slow, wiping it down. Again, kind of swooping all the needles back in. I would dispose of them. She's already gotten her IV piggyback, her by-mouth medicines, her injections. I'm going to sit with her, the adverse effects, making sure that nothing's interacting, again, assessing for any allergies since she's on antibiotics, heparin, watching her blood pressure with these medicines, and then I'm going to lower the bed back down, make sure her call light's here. Do you need anything?
Nope.
We'll be back soon, okay, to check on you, still providing her privacy. I'm going to document everything I did immediately into her medical records, into my chart. I'm going to dispose of my gloves, perform hand hygiene, and that's all.